Hello friends, today I will be discussing about the risk involved in liposuction. Liposuction is a body contouring surgery where we take out the fat through tiny holes, and this is mainly indicated for anterior abdominal bulge, fang bulge, thigh bulges, buttock bulges, breast and arms. We also do for the double chin area also where there is a hanging double chin fold. Now mainly risk can be categorized into the following categories: anesthesia risk, which is mainly in the domain of the anesthetist. There can be fluid imbalance during and after the surgery because of a lot of fat has been removed and this fluid has been infused. Seroma and hematoma is another set of complication that happens in the area of liposuction, where small oculi of fluid can accumulate or some blood can accumulate in a specific area. They needs to be aspirated in order to correct them. You can have fat embolism, which is very rare. It's mostly highlighted in Google search, but fat embolism is not at all common. Fat embolism happens when large bore cannulas are used, large liposuction cannulas are used, and fat globuli can go to the veins and go to the arteries, go to the lung, and therefore causing a fat embolism effect. So that is a dangerous complication and that needs a intensive care support and further management, but it's very uncommon. You can have a contour irregularity at the site of operation. Contour irregularity means the surface where the liposuction has been done can be uneven at points. So this is not a big problem. In case it's bothering you, then secondary correction can be done. Now the other sets of complication that we are thinking is mainly swelling and paresthesia. Swelling in the area of operation, swelling can happen. It takes time to go. For that we need to do lymphatic massaging where the fluid needs to be drained out to the periphery, and thus the swelling can be brought down quicker. Paresthesia is mainly in the area of operation because of nerve trauma. The nerve get damaged superficially, minutely, so this nerve takes time to recover, and that's why you can have abnormal sensation in the area of surgery, mainly in terms of pricking sensation, dull aching pain, feathery sensation, all sorts of non-conventional pain that you can think of can happen in paresthesia. So this takes time to recover. It takes around 1 month to 3 months for the paresthesia to go completely. The point where we do the liposuction, these are small incision points. They can show up a little scarring initially, but they do fade with time. It takes around 3 to 6 months to gradually fade with the adjacent skin. Wound infection is another set of complications which is rarely seen because the surgery is minimally invasive and we generally do in a very good environment, good cosmetic centers where the infection rate is anyway very low. Thank you so much for watching the video. In case you have any queries, you can get back to us. We will be very much happy to share our experience and answer those queries. Thank you so much.